with time, people are getting convinced that indeed the vaccine was working, because there are more healthy people who are walking around. And of course, then it was easy to talk to people and tell them that, now it's asymptomatic and you may get it from somebody who has no symptoms, but you are vulnerable and get it. And indeed, the rates of vaccination increased.
We have to work closely with the county as part of localization. So we plan together, so we design the program together, we finance together, we implement together, and we monitor together, and that's called the localization cycle.
We started off with a co-creation meetings in both of the counties with the CHMT and sub-county health management teams towards accelerating the uptake of COVID-19 to their populations.
Fahari Ya Jamii supported us in the initial training. Then later on, during the cascade training, they are still the ones who came in handy to support us to ensure that the training is cascaded to the sub-county level and also to the facility level.
The project came in handy in terms of providing support through vaccine distribution in the hard-to-reach areas and also in the facilities around Kajiado West.
They supported COVID outreaches, whereby we will go to the community and try to mobilize and vaccinate our clients.
It is Fahari Ya Jamii which has purchased the gadget, and also they equip us with airtime to register the patients in the system, and for the patients to be able to have their COVID vaccination certificates.
Through the support of USAID Fahari Ya Jamii, we are able to reach those people in this community in that hard-to-reach area. They support us to facilitate on transport, also to facilitate for the CHVs, and also to facilitate us to collect vaccine from the farthest place, which is Oltinga, which is a central plain.
Ore biyani election ya corona nalo hospitali na uti nadol maana yenye naya ina ujumbe community nenyorra sininje niponu metudi nedol ajo meeta madhara yoyote tosiseni.
In Kajiado West, we have what is called a differentiated service delivery model, whereby if the clients cannot come to us, we look for a way where we can get to them. And that is where the outreaches have really helped. So when we have outreaches, they are normally in the hard-to-reach areas, so we carry whatever we require and we go to a place that is near the villages, near the bomas, where now the clients can come out and have the services offered to them.
Before, watu hawakuwa wanaweza kufika facility sababu ya umbali ama distance. Kushirikiana na Fahari wa Jamii na county, tumewafikia nyumbani, watu waliweza kupata chanjo.
Covid-19 vaccination in Kajiado County has been targeting the elderly and the people with underlying comorbidities. By statistics, I can say that, for example, the people living with HIV, we've been able to vaccinate 75% of them out of a TX car of around 17,000.
In 2023, when the WHO declared COVID-19 an endemic, we were still required to support the counties to integrate COVID-19 vaccination. So we again came into speed to orientate the healthcare workers on how to include COVID-19 vaccination in routine vaccine, integrating it into all service delivery points so that the vaccination is still available to the general population. When they come for the normal healthcare services, they'll be vaccinated in any service delivery point of their choice.
With those integration and the outreaches that are supported by Fahari, we have managed to reach so many people, and I think that one has helped us a lot to boost both the COVID-19 immunization in the sub-county and the other services.
We're ensuring we are able to integrate this kind of vaccination and demand creation within these outreaches. And so far, I would say in Shompole, for the first outreach, we were able to reach 13 clients with the service. And then for Kajiado West, so far we've been able to reach 417 clients. So we have a plan to continue implementing this important service, both at the community and at the facility.
So across both counties, we were able to reach about 250,000 people with COVID-19 vaccination who otherwise would not have accessed it. outside of this support. So that was really, really huge.
We have registered very good results, and right now we are almost around 45% coverage for COVID-19 vaccination. If we compare Kajiado County and other pastoralist counties, we are far much ahead. So we really appreciate people taking their efforts. We've been able to take majority of our indicators and the mentioned subjects or programs.
We aim to have COVID analysis as part of the EPI, which is the General Immunization Program, such that it will be part of the routine immunization schedule for all our eligible population, and data review will continue as part of the expanded program on immunization.